Hello, I'm Dr. James Warson. I'm a specialist in equestrian medicine. I didn't start off that way. I started off as a neurosurgeon, but because of a lifelong interest in horses and the fact that there was no one else to treat the diseases of people that occur when they're around horses, I gravitated into this field, and I've been doing it for over 20 years. I'd like to introduce you to something called the Equicizer. Recently, I was doing research on the conditions of chronic fatigue syndrome and fibromyalgia and the use of Equicizers for their diagnosis and treatment. We discovered purely by accident that this was the perfect form of exercise to use for people that have osteoporosis. And the reason for this is that as you ride, when you ride, you exercise four muscles. On the back, these are the multifidus and the erector spinae. And in the front, these are the rectus abdominis, your six-pack muscles, and your iliopsoas muscle, a muscle that starts on the spine, like right here, and winds up all the way down here on your femur, your thigh bone, on the inside of your hip. When these muscles contract, what you're doing is you're contracting muscles that are attached to the spine. They stimulate the spine, and they stimulate within the spine little cells called osteoblasts that lay down bone. So if you've lost bone, you want to do things like this. And exercise against resistance is the way to do it, not stretching exercise. You need to do it against a weight. The Equicizer, has resistance, and if you'll just do some gentle riding, you can see that at the end of the arc here, gentle resistance builds up, and so she has to work her pelvis back the opposite way. And in doing so, she's working her spine, which is exactly what we want. This is the exactly correct exercise to use to stimulate the multifidus, the erector spinae, and the iliopsoas, so that they will contract, they'll stimulate the underlying bone, and the little osteoblasts will go to work to lay down more bone. The bisphosphonate medicines that your doctor may have prescribed for you will stop bone loss, but you've got to put that bone back through vitamin D, calcium, and exercise. And you have to be exercising correctly, you have to exercise the correct muscles, and in the correct manner. As it turns out scientifically, this is the only device that will really allow you to do it safely and correctly. Here a rider is doing more vigorous exercise at a canter, but you can still see that the movements are similar and the same muscles are being exercised. So you can increase your activity as you tolerate and do it safely, and you can do it in your own home and get a great workout for your spine, build your spine back up and get ready for spring riding or riding after any form of delay.